joining us. Welcome back to Advocacy in Action. This is a series of conversations taking listeners behind the scenes of advocacy campaigns that save lives. My name is Minna El Turki with the Global Health Advocacy Incubator, and today I'll be your host. Today we're going to be diving into the role of policy advocacy and ending violence against women and girls. I'll just use this opportunity to share a content warning with our audience, those listening now and those who listen in the future, that this episode of Advocacy in Action may and will mention different types and forms of gender-based violence. So today we're going to be talking with two incredible women who are leading the charge in several ways to address these serious and critical issues around ending violence against women and girls. We're going to have a chance to learn about their personal stories and their work, which is super, super inspirational. And we'll also learn more about how advocacy can be used to bring an end to this issue, to violence against women and girls, why policy advocacy is such an important element of this movement, and how it can change social norms and create gender equality and equity globally. Some facts, or a fact around this, estimates published by the WHO indicate that globally around 1 in 30%, 1 in 3 women have experienced violence in their lifetime, which is staggering. And there were lots of other facts and figures that were startling and staggering that I won't get into now, because we have two experts in the room who will be able to share more about the problem, the causes of the problem's factors, and also the aftermath and the effects of it, and then how we're going to change this. So please join me in welcoming Judge Najla Ayubi, who is the Chief of Coalition and Global Programs from Every Woman Treaty. It's an organization working towards a treaty to end violence against women and girls. And Dr. Rupa Dutt, who's the Executive Director and co-founder of Women in Global Health, an organization which is advancing gender equality in global health. I'm so excited for both of you to be here. And we'll actually get started with a few questions for Judge Najla. Like I just said, Judge Najla is the Chief of Coalition and Global Programs at Every Woman Treaty. Every Woman Treaty works with 1,700 frontline activists in over 128 countries around the world. She is a lawyer and former judge, has extensive experience in judiciary, elections, human rights, and women empowerment. She's a civil society, women, and human rights activist. Judge Najla, thanks again for joining us. Can you?
Hello, good morning. Yes, I can hear you. Happy to be here.
Good morning. Thank you again. So I have a few questions about you and your role and the work that Every Woman Treaty is doing. But to get us started, can you just tell us a little bit about how you got started in this work and what led you to your work with Every Woman Treaty?
Thank you so much. As you know, I'm a Najla Ayubi. I'm a former judge from Assam, and I'm born and raised in Afghanistan. Why I'm in this work? Actually, my mom was 12 years old when she got engaged, and then now even we are calculated probably 15 or 14 she got married. And listening to my mom story, being a child bride or a child girl bride, and particularly bringing 3 daughters to the world, like my older sister who passed away because my mom couldn't take care of her, because she herself was a baby or a kid, and also my older sister and me. And then she was blamed being bringing, like, it was like a crime for in my context that the woman bring 3 daughters to the world, not a son. So listening to my mom in a very young age, being probably in the age of 11, 12, I was realizing that how it's important to um, for a woman to be a victim of in a several aspects in several ways, because my father and my mother family both not they stopped talking to my mom because they thought this was a high level of crime commitment. So that's why while I was listening to my mom and my extended family, women in my extended family's stories, I realized that how the society is having injustice towards women, and I never thought that I would be. I would just, it makes me think to not be in the same place as my mom and my family members. And as you know, it's very hard in Afghanistan to be born as a girl, to be educated, to the higher education and to the higher position like a judge, which I was the first female judge in my province. So it was a very, very interesting experience, particularly when you go to the court and people were thinking that I was, because I was the first one, people were thinking that I committed crime. That's why I'm every day going to the court, because there was no one believed that the woman could do not only being an active member of the society, but also being in a powerful position like being a judge. So with all of those, and then even looking into my clients, working with my clients in the court, seeing that lots of discriminatory laws have been. I was the one that, unfortunately, I was applying that very highly discriminatory laws against women and against my clients in the court, and I had nothing, no power over it to change those laws and make a different decision. Though I was trying my best to do whatever I could, but still the laws were binding my hands not to go further. So that's why one of the reasons, and because of all of these, and being an active member, and even in the court, I was also discriminated against, because even I had no restroom when I was working in the court, because there was no way for a woman to be in that court. So with all of these, and then meeting some of the women that they were also victim survivors of the violence, and they were facing everyday violence. When I was studying in the UK, so I met those women that they were. I was really inspired by them, how they are facing violence every day, and they are surviving, and then coming out and working on the women's issues. That's why I realized that probably it might be the most important piece to be part of the, not only part of the implementing the law, but also making the law. So that's why in Afghanistan, particularly after the fall of Taliban, first time after the fall of Taliban, I managed to get to the making the constitution making process and different laws and legislations, incorporating and also mainstreaming women women and girls in gender issues in our legislation and even in the implementation. So that's why in 2007, 16, 17, I was part of the um, part of the Every Woman Treaty Coalition. And then 2020, I joined as a chief of global programs in coalition. And I'm happy to report, as you mentioned, we are working with 100 to 1,700 women's rights activists, frontline activists around the globe, and also with 840, more than 840 civil society organizations. And as you mentioned, also our mission is to advance in the creation, adoption, and implementation of the global treaty to end violence against women and girls. And this work has been like we are now almost 10 years in this work, and we are making lots of progress.
Thank you so much. As I was listening to you, especially the story about your mom and growing up in Afghanistan, and before this, as I was researching the issue and just reading more about the issue, I was just seeing how this issue, violence against women, has so many in the aftermath. You know, it's not just a singular standalone issue. It affects all parts of life, and that was really represented in the stories that you were just telling, that it does require a movement in all aspects of life to address this issue. Um, and you know, today we're talking about advocacy and policy advocacy around gender violence. And so I wanted to ask you, in your opinion, why is gender-based violence a policy issue, and what role does advocacy play in addressing this crisis?
Actually, it is one of the reasons, because the violence against women and gender-based violence and even discrimination is still there, and for thousands and thousands and thousands of year was there. And if we're not taking this serious and not uh, providing a solution or not making a solution, not only the current generation, but also generations and generations will come, they will be suffering. And particularly when we experience through one of the programs that we are offering, also through the treaty, we call it whole hand framework, because we really need to bring everybody in the society to the same page. Like, for instance, one of the proposals that we have through our global treaty is the reform of the law, which is important, and we have to do advocacy about around the reforms of the laws and in legislation, and also training and accountability for the judges, prosecutors, basically help health workers and doctors and police and everyone who are responding, first responders to the violence against women and girls and gender-based violence. And also prevention education, as you mentioned, it's very, very important how prevention education is really, really playing the important role in the society, particularly among the boys and girls. How the boy, scientifically there is a very clear fact that the boys and men are social change, social mind change is happening between the age of 9 to 22. So basically, working with these men from young age of 9 to 22 will definitely make a lot of sense, and also for girls and women, how they uh, how they can understand about their rights and also how they can demand it. And then the services, basically providing the services. We really need to do all the advocacy, not only around the whole laws and legislation, but also the implementation. Providing services, as you mentioned, the long impact on the women and girls being survivor of the violence or victims of violence is a very, very huge in a very long term, particularly when the women um, uh, uh, against if violence against women is happening, the woman will lose the support, the family support, the work, the social status, and even taking the woman, and they will actually lose anything in their life. So it will definitely affect their economy, the family, the children, and how the children will grow later. It's a kind of a very long term impact. So that's why it's important to make advocacy around providing services for women and girls who are victims of or survivors of violence. And then funding is also another piece that we also really need to do more advocacy around it, because right now we are spending $11 per female on Earth uh, responding to violence against women. And what we are also proposing is $1 per female on Earth to make it $4 billion to responding for violence against women and gender-based violence. So all of these are not possible if you're not creating a measure in monitoring and evaluation mechanisms in place, a strong one that we can make the heads of the state and the perpetrators responsible and accountable. So all of these, definitely the importance of the advocacy is really needed, and we really need to do advocacy not only at the national level or even local level, national, regional, and also global, because this is as we call it, and I think this is the Global Health Organization is also calling it a shadow pandemic. And with this shadow pandemic, we have to make a very clear pathway to end violence against women.
Absolutely, and I think you framed the like the process of advocacy really well, and that it's not just let's just pass this law and see what happens at the national level or local level. It's passing the law, it's the implementation, it's securing funding. So it is a really comprehensive approach. And one thing that you highlighted as well is that the importance of the education with boys and men, and that really highlights that this is an issue that everyone needs to address. It's not just women that need to look at it, it's women and men, and the older generation, younger generation. This is an issue that impacts so many parts of life. So the advocacy also has to reflect that in being comprehensive and inclusive and addressing things at a global, national, local, regional, at all levels. Um, I know that the Every Woman Treaty, it's been around for 10 years and has compared laws around the world. So can you talk about a little bit where we are making progress and what that looks like, and then what are the most areas to address?
Thank you. Yeah, definitely. So, based on our research and almost like we were in the research and gathering information and collecting facts and figures, and since 2013 to 2019, um, uh, consulting with different groups, frontline activists, experts, lawyers, doctors, who everyone from every walks of their life, and then we come up with a summary of what is the gap actually. We identified the gap, like there is a huge normative gap at the global level, normative gap, geographic gap, and also the enforcement gap. On the normative gap, unfortunately, we don't have violence against women is not comprehensively covered in any single specialized treaty. So that's why we feel that we have to work towards that. We have certain mechanisms and certain systems in place globally, but not all of them are responding universally to violence against women and girls. And also geographically, I don't know, there are, I'm sure many of you know that there are different regional treaties that are addressing violence against women, like Balam-Bipara, Maputo Protocol, and also Istanbul Convention. But unfortunately, as you know, 75% of the women at the global south are not covered by any regional treaty. So it means that like 75% of women, mainly brown and black women, are and not covered by any regional or global treaties, particularly addressing rights against women. That's the geographic gap that we have to really close this gap through. We are That's why we are working to close this gap, and also enforcement gap. Unfortunately, in many current legal systems and current legal frameworks, we have really good, interesting mechanisms, but they are not actually what we say. Uh, you get what you measure. Unfortunately, we are not measuring. Majority of our ratings are narrative based instead of the facts and numbers. So that's why we are also proposing to. We also identify that how the monitoring and evaluation mechanism could be very strong, put in place, that this will also play a huge role in in implementation of the laws at the global level. So therefore, we right now I'm happy to report that we already met more than 107 representatives of diplomats of over 107 countries or nations. We have made lots of progresses. I don't know if you, I'm sure that you have heard about President Buhari, President of Nigeria, 2000, late 2021 called for the global treaty ending violence against women and girls. Also, General Secretary of Organization of American States, Secretary Almagro also called for the global treaty ending violence against women and girls. President Tshisekedi of the Congo, he called for the global treaty ending violence against women. And recently, um, in June 2022, President of Colombia, he called for the global treaty. It means that we have global leaders are lining up and calling for the global treaty. And it means that if these leaders who are interacting with not only with the government but also with the civil society, they realize that how the need of the global treaty is right now to make
Mm-hmm.
sure that the women and girls are getting the protection and security that they need.
That's incredible progress, and when you highlighted the huge gap, the geographical gap, and in terms of that 75% of women in the global south are not covered by anything at the moment against violence against women. So it really shows that looking at this from a global perspective and the advocacy at a global level, which every women treaty is doing and picking up that traction, is critical to be able to protect women globally and not just in certain areas of the world. um, the last question I have is, about the work you're doing in building and cultivating political champions, which, as you were just saying, that the treaty, calling for the treaty, is building traction around the world. So can you tell us a little bit about that work and the successes that Every Woman Treaty has had in cultivating those champions and how they've approached it?
Thank you so much. Definitely, we have a program called the Voices Program, and we work with our activists from around the world. And we offer them 40 hours fellowship program. This is fully online. We work with them, and then we are not calling them the capacity building, but because we are working and we are also learning from them. That's the program that we prepare our activists with the talking points, with the knowledge of the international global system, international legal systems, and also how they can also face the media training, media coach, and then we work with them to extend or to expand our coalition at the national level. Like for instance, um, right now, I'm sure that we are talking about the 1,700. Probably we are probably more than 2,000 already. So means that we our activists are the ones that they are to the lead. in their relevant countries. For instance, we call them the lead activists. So they are taking the lead in talking to their own governments, and majority of them are really, really having a very high level of influence in their government. So through our activities, we get connected with these heads of ministries of foreign affairs, women's affairs, and then we try to identify the organizations that can also work with us on the ground. So that's why we are working together in making sure not only at the national level, but also globally, we are also working with diplomats from relevant countries that we see the good signs of positive response to this request. So that's also another piece that is really a good combination of the activists and also diplomats, that they are really keen into taking this call and request. So that's why we are working with both government and then civil society, and making sure that there is enough information, providing background, providing platforms for our activists, even for the diplomats, because many of diplomats personally are really affected from this issue, that they are really wanted to be part of it. So that's why they are approach, and then that's why our activists actually taking the lead, and in many of these events, we have activists are leading the meeting. We're just there to support. I'm an activist, but still, in my role, I'm also trying to just give the platform more to our activists to bring the issues, because activists knows what is really going on the ground, as maybe in our relevant countries, but not everywhere in the world, because the local context is so important that and also the connections in providing that platform for the activists in civil society to work with their relevant gaps.
So I love what you basically said about the training and the providing resources and also learning from the activists. And this is something that as advocates and activists, as we're all working on various issues and different issues, this is one of the most critical pieces, is providing the activists that are that want to be involved with the platform and the connections needed. Oftentimes I find people want to do something, people want to be involved, but they're not really sure where to go. So providing that network of sharing and learning, then they're able to go back to their own governments and use examples from other countries, or share what they've learned, and then also teach others. So building a network of 2,000 activists is incredible, and we're already seeing some of the results. So thank you so much. That was my last question. Thank you so much. I've learned so much from this conversation, and stick around. I'll be switching gears to talk to Dr. Rupa Dutt, and then I'll have just a last question for you at the end. But thank you so much.
Sure. Thank you so much.
So, like I said, Dr. Rupa Dutt from Women in Global Health is the executive director and co founder. This is a women led movement challenging power and privilege for gender equity in global health. She's also a practicing internal medicine physician at Georgetown University Hospital in Washington, D.C. Dr. Rupa Dutt, welcome. Can you hear me?
Yes, I can. It's great to be here.
It's well to have you. Thank you so much. So, just to get us started, can you just tell us a little bit about the work you're doing, and how you ended up becoming one of the co founders of Women in Global Health?
Uh, thank you, Mina. But before I kick off, I just also want to acknowledge really the very powerful story and journey of the judge here that we have with us. And I have to say, your personal, a life experiences being a driver for then going on to drive decades of change is just really amazing. And I am just very touched by a story and very inspired. And I think that's a good segue to also share a little bit about my own journey and what led me to be a co-founder of Women in Global Health. And I think even before being a co-founder of Women in Global Health is really becoming a advocate for gender equity issues. I too am a Indian American immigrant from a similar region as the judge, and come from a very conservative part of India, which is called Punjab. And growing up, I was often reminded about the differences that girls and women have between men, and it did limit what I could do. It limited what opportunities were afforded to me, and I was definitely already at a young age someone very keen to challenge those gender norms. And so it was always early on that I knew that the women in my family, my grandmother, my mother, my aunts, had faced a range of gender norm constrictions, and some of those were incredibly harmful. They have stories of facing personal violence as well. But for me, the journey to finding my calling in addressing health disparities was the very first advocacy calling. So I was about 9 years old when I went to India. I was growing up in the US, and I had gone back in the summer to spend time with my grandparents, and I ended up getting really sick. Ended up with sepsis, a really bad infection, and didn't quite know the source, and required hospital care and surgery. And India still continues to be a country which there are wide health disparities and not the best infrastructure for healthcare. And this was during the 1990s, and I was very fortunate to be able to get into a hospital where there was a pediatric surgeon, and I did have the financial resources to be able to afford the care, since it is out of pocket expenditure for care, and my life was saved. But as I spent about a month in the hospital, in the pediatric ward, and in the hospital, in many countries, pediatric ward is a shared ward with at least a dozen different children, and that 1 month made a huge impression on me. I knew that after I would be discharged, a couple weeks later, I would be back in the US, and it really did not make sense to me how we could be in this one world and have such wide spanning disparities, especially on health, which I, even at an early age, saw as a human right. So I made it a personal commitment that I was going to become a physician, and I kept going around as a 9-year-old, and stayed committed. And fast forward a decade later, I got very involved with a international group of students called the International Federation of Medical Student Associations. That's a mouthful. It's IFMSA, and it was during my time in this organization for 5 years that I really began to explore what advocacy and global advocacy could look like. And similar to how the judge shared examples of mobilization that can happen at the global level, at the regional level, at the national and local level, it was through this organization that I was able to experience that, to co-create, to build advocacy structures, since it was an organization that was present in at least 130 different countries. And it was during my time in leading this federation as the vice president, and then going on to being the president, that I started seeing how gender really was affecting my ability to influence and lead. And there was such a stark difference when I was a vice president, or I had a lower position in the organogram, how people would engage and interact with me. And it was almost as if like a light switch went off. When I became president, the gender bias just became so apparent. I was after any speech, I would have colleagues on the team say, "Oh, you're such a cheerleader for our organization," even if it would be a very powerful, emotionally driven, fact-based. Didn't matter what the style of the speech would be, but there was always this undertone of, undermining the leadership. And it was at that point that I realized, while I might have overcome a lot of barriers that women from my cultural background face in their communities and their families, when it comes to broader societal, I'm still facing gender bias. And then after that light switch, it was almost like every part of global health, every part of medical training, I was seeing, wow, there's so many talented women here. Yet when you take a look at leading roles, decision-making roles, who's in the decision-making rooms, women are underrepresented. And just to put the facts out there, 70% of the global health workforce are women. But when you take a look at who's leading, whether it's in academia, in ministerial rooms, global health institutions, those numbers quickly dwindle to about 25%, and they have not changed in the last few decades significantly. So this is what inspired me on the issue. Very much a personal journey, and it was really seeing this firsthand, experiencing it, and then having other women. As I said, the word co-founder is that we found that so many women have felt that gender bias, and some of the most senior women have felt it. But when a mentor of mine, Professor Lena Cake Bush, launched a social media campaign called hashtag WGH100 in response to an all-male panel in global health, where the hashtag was meant to evoke, here are 100 names of women experts in global health who you can invite and to panels, so that there no longer is a all male conversation happening. That 100 became 200 and 300, and it really activated the global health community, women in the global health community. And it was when I turned to her and said, how do we take this forward? She said, well, the next generation has a responsibility. And it was actually on Twitter. So it's great to be able to talk on this platform, Twitter, that I was able to find other co-founders who wanted to not only talk about the problems, but be solution oriented. And Judge said previously, these problems have been existing for centuries and thousands of years, and we need solutions to make sure that we make progress and that these problems do not exist. And so it was how we came together and then co-founded Women in Global Health, and really to address the gender equity issues in global health, but particularly when it comes to power, leadership, decision making.
Thank you so much. There was so much from that story that I'm writing down, but it was really interesting to hear for me, from when you were younger, and having that lack of representation, those limiting opportunities, gender norm restrictions at a young age, and then seeing it again in a different way as you got older, and then taking that moment to start making the change, or even making the change from an earlier stage. Also, something you mentioned, which I see a lot. I'm Egyptian American, and that health disparity of people who grew up in the States, or lived here, came here at a young age, and still go back to their parents' country, and kind of are shocked at the differences. And they we find ourselves often in global health, and I see a lot of people who have this story in the States and globally, going from that perspective to start working in global health and addressing these issues. In regards to gender-based violence, so gender-based violence is directly related to power and privilege that your organization addresses. So what does gender-based violence look like in the health sector, and why do you think the health sector is vulnerable or more prone to violence against women?
It's a really big question with a lot of aspects to it, and one that I've seen and firsthand as being a provider, seeing patients myself, supporting trainees, medical students, working closely with nurses. So there are too many times where sexual exploitation abuse is taking place in the healthcare setting, but it's being completely ignored and it's a taboo subject. So I do want to open up with the fact that we are having this conversation is great. The fact that we're acknowledging that sexual exploitation abuse can occur in the healthcare setting, we're already pushing the envelope forward. And particularly women health professionals, they can be exposed to abuse from their colleagues, their superiors, but also from patients and patients' family members and others in the community. So we often think about healthcare providers as caring for their communities, but we rarely talk about how the communities themselves and the patients can also be a source of violence that health professionals face, and particularly women. The severity and form of the problem for women health professionals varies in different contexts, particularly those that tend to be in more fragile states, conflict and humanitarian contexts, but it is universal. Data that has been collected in high income countries where there is a lot of stability, to settings where there is a lot of conflict and it's a fragile state. We see over and over again that 30% of women in the health profession have reported some form of sexual exploitation, abuse, and harassment, bullying, and those numbers go up easily to 50, and sometimes even 2/3. So there is a wide range that's happening, and it's a universal issue. Women health workers in all regions report work-related violence and harassment, but when you apply a power, lens to this, and apply intersectionality, and recognizing that it's not just women as a group, but women that have multiple identities at the same time, what you notice is that younger women, migrants, women from marginalized groups based on certain racial, caste, or other groups, particularly those that will have less power and privilege in a society, tend to have higher rates of violence and harassment. And we also know that the violence has only increased during the pandemic. The causes vary, and that itself can be a talk. But to cover some of the things that we're seeing in the healthcare sector that's unique is women are segregated into lower status jobs. There's systemic bias and gender discrimination. There's often a lack of governance and policy and management in health systems to serve as a protection or deterrent. There's often protection of abusers, so often men in higher positions are protected. And the mental cost and standard of proof with relation to remedial actions is put onto the victim, the person that has experienced, or the survivor that has experienced this act of violence. And there's a fear of retaliation, and this fear is very much grounded in reality because retaliation does happen for those survivors that speak out. The hierarchical nature of the medical profession, and we have to look at the history of it. Health systems are designed by men for men. While majority of the health workforce are women, they're not the ones designing health systems even today. And so it is, a hierarchy nature of the profession. And then you look at the occupational segregation of women being in the lower status jobs. When you look at nursing or midwifery, community health workers, in those cadre, which are often considered lower status, even though very much essential to a functional health system, 90% of them are women, and yet are not in the decision-making roles. And so they're seen as caretakers, and women represent the care aspect. So all of these things like interplay and perpetuate the violence that women are facing, the gender-based violence in the health sector.
So like I was saying earlier, thank you for that overview and understanding. And like I was saying earlier, as I was reading about these topics before this conversation, this issue affects so many facets of life, and even within the healthcare sector, it's just so deep and hard, kind of hard to wrap our heads around. And like you said, a lot of the institutions and healthcare systems were built by men for men, and you see that across so many other institutions and other sectors that were historically built by men, and now we're seeing a lot of these problems popping up everywhere, or they've been everywhere for a long time. And so I know we're running out of time. We have just a minute left. But what policies should global health advocates be championing in order to achieve that's more collaborative, supportive, and empowering and safe for women? How do we address these issues, and what do we need to hear from women in the global South that we might not be paying enough attention to?
Yeah, a minute's not enough to really even talk about what policy needed. I think the first thing is we need data and evidence. Women in Global Health has just launched a Health 2 campaign. I encourage all of you to check it out and encourage your friends, colleagues, the broader health community and the societies you work in to provide their stories so that we can really show what extent the problem really is. That has never happened before. So the first thing is capturing the stories, capturing the data and the evidence. We've launched an initiative called the Gender Equal Health and Care Workforce Initiative that was launched in 2021, now led by France and Women in Health, where we are really driving the policy action through governments and other multi-stakeholders, NGOs, UN agencies, civil society organizations. So we invite you to join this initiative to be part of the collective action and the policies that we really need. We must put laws. As a judge has spoken on the importance of laws, this applies very much to having the ILO Convention 190 on work-related violence and harassment to be ratified in all countries around the world. We need to have policies in place that really protect and ensure that there isn't retaliation for survivors when they do come out and report what has happened to them. And we need mechanisms in place to make sure that these policies don't just exist as writing on the wall, but are implemented and trusted, and the mechanisms that are created are truly being able to be exercised. And I have to say that this begins with making sure that men and women are in equal leadership levels. Too often we go quickly to putting a solution forward, but not look at the power and where the power lies. We need the power that women have to be represented, with women being in decision-making roles and leading roles in equal numbers in the health sector, so that we can make sure that the challenges women are facing in the workplace are being addressed. And this is just, again, tip of the iceberg.
Okay, so I missed that last part, but everything was beautifully said. Exactly, tip of the iceberg. It's just the beginning, and exactly what you were saying in terms of we need to be authentic about making these changes and not just putting quick solutions in place. I know we're at the end of this talk, so I won't get to ask the last question to both of you, but I wanted to thank you both so much for joining us. I really enjoyed the conversation, and Judge Nejla, your stories and your answers were beautifully said and so inspirational, and Dr. Dot as well. I have so much more to learn about this issue, as I think we all do, and how these issues can be implemented in my own work, in my own advocacy work on these other public health issues, and how to keep this in mind. Thank you again, and I'd also like to thank all of our guests for joining us today, and as well. Sorry. Okay, so and sharing their stories in this episode of Advocacy in Action, and all the listeners for tuning in. You can find more information about future episodes by following Global Health Advocacy Incubator on Twitter at incubator_GHAI, and on our website at advocacyincubator.org. We hope you continue to join us as we continue to explore what's working and what's not, and what's coming next for global health advocacy. I'll see you next time. Thank you, everyone.
Thank
Thank you.
you.